Hello friends, welcome back to my channel. Today I am going to tell you regarding the reading part A, tips and tricks and how to find out the answers. First of all friends, just look overview proper in all the text like text A, text B, text C and text D. First of all, when we are getting the paper or exam sheet, question sheet, we have to just make four columns, and in these four columns, see, first one is the overview. Okay, overview. Next, second is the sign and symptoms. Okay, third one is the treatment part. Okay, third one is the treatment part, and fourth one is the prevention part. Mostly all the paragraphs are like this only. Okay, so see friends, in this all these are the prevention and immunization. Okay, so this is the text overview. After that we have to move toward the question first part, like question number 1 to 7, and this is the text. We have to find the text, which text contain these all the information. Okay, so like this first question is the time ranges in which tetanus symptoms may begin. So obvious we have to move towards the B, text B. Okay, so see, in text B sign and symptoms are mentioned, and the question is how much time. So time period obvious is mentioned in text B. So see friends, here symptoms of the tetanus usually develop between 21 to 30 days. So this is the answer. So like this we have to write B. Okay, next is second question. Moving towards the second, how long tetanus spore can survive outside the body. Means tetanus spore hai, that how much time they are outside the body. So again we have to move toward the A text. Okay, so see friends, here in A text is here. So we have to find how long outside the body. Okay, bacteria, like here is they have mentioned the bacteria produce spore that survive in the environment. So outside means environment. This is a synonym for long term period, particularly in soil, dust, so this is all the information is given in the text A. So answer is text A. Second question's answer is A. Next is question number third. The name of the toxin responsible for tetanus symptom. So in this we again move toward the text A. Name of the toxin responsible for the tetanus symptoms. So toxin, mainly we have to find a toxin. So the toxin here it's mentioned. Once inside the body, the spore release a toxin. तो toxin कौन सा है? Tetanus which affect the nervous system. So the answer is in text A. Okay, so third answer is A. Then is fourth one is again the recommended action. The recommended action for a patient with an uncleaned wound and no recent vaccine. So recommended action for a patient with an uncleaned wound and no recommended vaccination. So obvious here vaccination is main point. So this vaccination, about vaccination, directly go to text D, because here see it's mentioned immunization. So for this fourth answer is D. So vaccine is here mentioned. Okay, next question is so sorry, I have to elaborate the recommended action for an uncleaned wound. Okay, so here followed booster should be in case of injury expression. So here they have mentioned contaminated wound. Okay, uncleaned wound is uncontaminated wound, and booster dose recommended is the, so this is all given in this line. Okay, so answer is D. Okay, answer is D for 4. Okay, next is fifth, reason for hospitalization in tetanus cases. So what is the reason for hospitalization in case of tetanus? So for this hospitalization, see, immunization and prevention is another thing. Okay, so for hospitalization, see, high ICU and everything is written treatment. So for this the answer will be C, because first intensive care unit, mechanical ventilator, these are all in the, and tetanus is a medical emergency that required immediate hospitalization. So for this, answer C is for fifth, okay, question. Okay, next one is a list of, sixth one is a list of early and advanced tetanus symptoms. So proper advanced symptoms, so obvious the headings is very clarified that text B is regarding the this sign and symptoms, okay. So the direct we have to answer for 6 is B, okay. Next is seventh question, the vaccine used to protect newborn from tetanus. Again, so D part is for the vaccination or immunization, okay. So for answer 7 is D answer, okay. So these are the first part completed. Next is question number A to 10. So here answer the following questions using the information in the text. So जो already mentioned in the text information है, we have to check and write the answer, okay. So well, first question number 8 is, what type of injury mostly commonly lead to tetanus infection, okay. So for this we have to see type of injury keyword, then tetanus infection. So see here we have to move toward text number A. First of all we have to check the text number A. So well friends, uh, when we skim and scan, see here it's mentioned open wounds such as puncture injuries. So which type of injury is puncture injury? So we have to write puncture injuries is the answer for 8th question, okay. So well, next we have to move toward the question number 9. Is tetanus contagious from person to person? So contagious means is contaminated, okay. So contaminated or cross infection towards other. So we have to find out the answer for this. So well is, so we have to find out the answer. We have to move towards again toward A first, okay. So in A, here they have written, see friends, tetanus is not transmitted from person to person. So our answer is no for question number 9, okay. So well, next is 10th question. 10th question is, what antibiotic option are used to treat tetanus? What antibiotic? So antibiotic, we have to find out the antibiotic for the treatment of tetanus, okay. So now for this we have to move again to A. First of all check A, it's a just for transmission, okay. Next is again sign and symptoms, but for treatment they have mentioned in the part text C. So here C, antibiotics, okay. So here in text number C they have mentioned infections such as, and antibiotics such as midazolam and penicillin to kill the antibiotics. So for this question number 10, this is 10th question. So answer is midazolam, metronidazole or penicillin, okay. So this is the answer. Well, next question is, what does TIG stand for in the tetanus treatment? So well, again move toward text number A. So A, there is nothing about TIG. फिर again TIG nothing. Then again in text C they have written C regarding TIG. C. So TIG means here. So the TIG stands for here tetanus immunoglobulin. Answer is this for question number 11. Okay, well, again next move toward 12. How does the tetanus toxin affect the body? Now tetanus toxin affect, how it will affect on the body. So for this we have to move again on text A. So see here they have written anything. Tetanus is no. Effect we have to find just about effect. Yeah. So effect is mentioned. See friends, affect the nervous system. So it will affect how effect on the nervous system. Okay. So nervous system is the answer for question number 12. Okay. Well, next question is 13 question. What are the two key preventive steps mentioned beside vaccination? Now, beside this, beside this vaccination, what are the key preventive steps? The question is 13, and we have to move and directly go to the vaccination part, and vaccination part is given in text number D. Okay. So beside vaccine, what are other preventive measures we have to take for tetanus is fine, and here it's not mentioned. See friends, vaccination, the T series and booster, no, here it's not mentioned. Yes. So the first thing is for this first contaminated wound इंजरीज शो है. सो वुंड है पोस्ट एक बूस्टर डोज. ओके. वैक्सीनेशन इज फॉर वन इज पोस्ट इंजरी booster vaccination and another one is the wound hygiene. Okay. So these are wound hygiene. Okay. Proper wound hygiene also play a key role. Okay. So also means this is one is the second one. Okay. But first one is injury. In case of injury, especially with contaminated wound, a booster dose is recommended. So 1 and 2 keywords are given. So we have to write wound hygiene and post injury boosted vaccination. Okay. So this is the question number 13. Okay. Next is question number 14. At what interval should tetanus booster vaccine be given to the adults? Okay. For adults, booster dose. So again move toward the this part text D only. So here they have mentioned every 10 year. ठीक है. Followed, this is during the season, followed booster dose is at 10 years. Okay. So this is 14 question. Well, next move toward the 15 one. It's just a completion of sentences using words or phrases from the text. Okay. So well, here first one is tetanus is caused by bacteria known as. So we have to move directly to the A because here it's all over about the overview. Okay. So the answer is see here, Clostridium tetani. ठीक है. So this is the main bacteria which is caused infection for the tetanus. Okay. Well, this is the answer number 15. Okay. 15. Next question number 16 is the most characteristic early symptoms of tetanus is. So early symptoms, so we have directly go to sign and symptoms parts, and that is the part text B only. And most early one, see here friends, early sign includes stiffness in the lock jaw. So we have to write answer, that is stiffness in jaw or lock jaw. Okay. So this is the answer. Well, next another one is 17 question, and the 17 question is the toxin produced in tetanus affect the system, affect the dash system. Okay. So which system is affected in tetanus toxin? So here is the answer is given, nervous system. Okay. Nervous system will affect. Okay. So this for this it's answer of 17 question. Well, next one is 18. 18 question is tetanus patient with respiratory issues may need dash sport. Okay. So which sport patient need for this? See, first one is for the overview, second one is for the sign and symptoms, and for this treatment is we have to move toward the text number C, and the answer for this is see patient, sorry, patients patient may also require muscle and mechanical ventilation. So for this answer is mechanical ventilation, that is a supportive care in ICU is only mechanical ventilation. So ventilation for this is mechanical ventilation is the answer for 18 question. Okay, well, next is 19 question. 19 question is tetanus vaccine in pregnancy help prevent dash tetanus. So in pregnancy, tetanus vaccine help in dash vaccine. So for this, move toward the vaccination side, that is immunization, and the answer for this is we have to find out here is newborn tetanus. So here they have mentioned pregnant women are advised to receive the tetanus vaccine to protect newborn from neonatal tetanus. Okay, so answer for 19 is neonatal tetanus. Okay, and the last question is question number 20th, that is question is if untreated tetanus can result in life threatening. So life threatening, so main here it's mentioned because with the tetanus mainly it will effect on our respiratory system. So we have to find out the answer. So here it's mentioned in part B that main is due to the breathing difficulty and our respiratory muscle will be affected. So for this answer is respiratory. Okay, respiratory muscle will affect. So this is the regarding reading part A. So all the 20 questions in exam you just given only 15 minutes to complete the 20. From the initial phase, start skimming and scanning and underline the main points, and you will be helpful in getting the answers. So thank you friends for watching my video. Thank you once again.